Good morning and welcome to our leading local webinar on navigating reopening anxiety. My name is Erica Manuel. I am the CEO and Executive Director of the Institute for Local Government, and I will be your moderator today. I am so excited to be with all of you. And before we get started, just a couple of housekeeping notes and disclaimers that we are recording today's webinar, and we're going to share that recording and all the related resources with all of the registrants immediately following the webinar. All of your lines have been muted for the duration of this session, but you can ask a question at any time by typing it into the questions box at the right-hand side of your screen. Anything you put in that questions box will be directed to panelists and the moderators and hosts only. So we will see your questions, but they will be anonymous to the other registrants. So feel free to ask whatever is on your mind today. We do have time set aside for Q&A today at the end of our session, but you can put your questions in at any time, and we will try to take as many questions as possible during the time that we have. And if you have any technical difficulties during this session, you can use either the chat or the Q&A or question function, which are both text boxes, and one of our session coordinators will assist you. So today's webinar is part of ILG's new Leading Local webinar series, which was designed to help local leaders understand how to continue to serve as role models for their communities and their peers in these ever-changing times. Leading Local is a new thought leadership forum that we designed. It's focused on addressing some of the most difficult and sensitive issues that local government leaders are facing right now. We've identified a wide range of topics and are going to cover some issues and challenges like leading through conflict, civility, ethics, building personal resilience, and a lot more. And because budgets are tight and time is ticking, all of these Leading Local sessions will be free and specially curated with content for elected officials and staff at California's cities, counties, and special districts. Next slide, please. So today's webinar is focused on navigating reopening anxiety, and we're going to be addressing the personal, legal, and operational impacts of return to work. After more than a year of these shelter-in-place orders, a lot of local government agencies have really begun this process of fully reopening workplaces. But now local government leaders are in this unique position of having to consider the mental health impacts of new workplace policies, as well as the legal and operational challenges of enforcement and implementation. So in today's webinar, we're going to explore the anxiety that local leaders and staff might be feeling about the evolving COVID reopening guidance and discuss some strategies to balance self-care considerations with shifting state and federal requirements. We're also going to acknowledge and discuss that there's a wide range of emotions that we all might be experiencing, as well as that balancing act of having to be both a leader and a human being during this trying time. Our agenda for today's webinar is pretty simple, and I'll give you a short overview of ILG for those of you that are not familiar with our organization, and then we'll move right into our panel discussion. We've structured the webinar to be pretty free-flowing to allow some time for questions throughout or at the end. But I'm gonna have to acknowledge that this is a really dense topic, right? And that we're gonna, we could literally stay here for hours talking about it. We certainly won't be able to do that today, but we are going to try to cover some of the high points that might be relevant to your roles. And we're gonna try and do this in an hour so we can get on with our busy Fridays. Next slide, please. If you are just joining us, this is a quick reminder for all participants on how to ask a question during the webinar. Just a note that all participants will be on mute during the entire presentation. And if you have any questions for our panelists at any time throughout the webinar, just type those questions into the questions box and we'll work throughout the webinar to review those questions and figure out if and how we can ask those. We'll try and get to as many of them as possible given the time that we have. Next slide. So before we dive into the panelist introductions, I do want to tell you a little bit about ILG if you're not familiar. As I mentioned during the introduction, my name is Erica Manuel. I am the CEO and Executive Director of the Institute for Local Government. ILG is a nonpartisan and nonprofit organization, and we are here to help local government agencies. We are the training and education affiliate of 3 statewide associations representing local governments. That's the League of California Cities, CSAC, and the California Special Districts Association. Together with our 3 affiliates, we serve over 2,500 local agencies, and that includes cities, counties, and special districts. We provide practical and easy to use resources so that local agency leaders can really effectively implement policies on the ground. Everything that we do at ILG centers around helping local leaders navigate the complexity of their roles. And that's one of the reasons why we're so excited about this webinar today. The Leading Local series is really focused on acknowledging the pressures of local leadership and supporting each of you during this time. So ILG has 4 main program areas or pillars of work. And on the next slide, you're going to see what those are. And our session today is focused on leadership and governance. Next slide. ILG's leadership and governance work has been a foundation of our organization for a lot of years. And that's because the organization really believes that focusing on leadership and ethics, accountability, and equity will help cities, counties, and special districts really increase trust with their residents and in their communities. The resources that we offer and the consulting services we provide help elected leaders and staff build a really strong foundation of good government. And that includes trust, accountability, responsiveness, and transparency. Our team offers a really wide range of virtual and in-person trainings and facilitated discussions and workshops, and we cover topics like effective leadership and culture, effective councils and boards, personal and organizational ethics, anti-harassment training, good governance, roles and responsibilities of elected officials versus staff. That's a really popular one lately. So if you could use that support at your local agency, please visit our website or email me to learn more. Next slide. So let's get to our panel presentation. I am so excited and humbled and honored to share this virtual webinar stage with a really all-star panel of experts this morning. We have 3 experts in 3 distinct areas related to our topic. First, to discuss the psychological and mental health aspects of our discussion, we are lucky to have Dr. Miguel Gallardo. Dr. Gallardo is a professor of psychology and the program director of Aliento, which is the Center for Latinos Communities at Pepperdine University. He's a licensed psychologist, and he maintains an independent consulting practice where he offers therapy, forensic and legal psychological assessments, and consults with organizations on developing culturally responsive systems. Hello, Professor Gallardo. We are also lucky to have, thank you. We are also lucky to have Michael Youril. He's a partner with Liebert, Cassidy, Whitmore. Michael's an expert in employment and labor law. He has extensive experience in retirement and health benefit laws. He regularly litigates cases involving discrimination, harassment, retaliation, whistleblowers, due process, and the Fair Labor Standards Act. Michael has and provides advice and counsel to employers and employee leave rights, employees with disabilities, reasonable accommodations, and a lot more. And so today's discussion is really in perfect alignment with his skills. Please join me in welcoming Michael.
Good morning, everyone.
Our last panelist is here to explain how one agency has operationalized this issue with an evolving policy to address our current state of affairs. Rob Lechner is the Director of Facilities and Security Operations for the Sacramento Municipal Utility District, or SMUD. SMUD is the nation's 6th largest community-owned and not-for-profit electric service provider, and they've been providing electricity to the Sacramento County region for nearly 75 years, and they serve over 1.5 million people, and they have over 2,000 employees. So SMUD is a really recognized and industry leader and award winner for innovation and sustainability. But today we're going to learn about their approach to this challenge from an employer and a special district standpoint. Rob is leading implementation of SMUD's post-COVID work policy and is going to tell us about how they developed their plan, what lessons they've learned, and what they're planning to do next as this guidance evolves. And then prior to working at SMUD, Rob also worked at the city of Lodi. So he has unique experience at both a special district and a city. So thank you for joining us, Rob.
You're welcome. Good morning, everyone.
As you can see, we have an absolutely phenomenal group assembled for you today. And as you have virtually done, I'm sure you're all clapping from behind your screens. Thank you for joining me and welcoming all of these panelists. So we're going to dive right in. I will ask that we drop the slide back, and I'd love to have Dr. Gallardo come back online, and we can begin today with just a conversation about some of the mental health impacts of COVID and some of the things that we might be experiencing in the local government sector. Dr. Gallardo, as you know, many local government leaders are wearing 2 hats right now. They might be wearing their leadership hat, which speaks to them keeping their organizations running, their cities, their counties, their special districts operating smoothly given all of the pressure. And then they're also probably wearing this employee hat, the hat of the person that's maybe getting their kids back up and running, going to school, trying to figure out how to navigate their own personal safety, their own personal commitments in a very, very rapidly changing environment. So can you talk about how people and leaders in particular might be feeling conflicted with these 2 roles?
Yeah, no, thank you, Erica. Thanks for the invitation as well. I think first off, it's important to just acknowledge that as a leader, we're not immune to all the effects of the world around us in the context in which we find ourselves. And so I think there's something, I think, very meaningful and powerful about even just sharing in the collective, grief and loss that I think many of us have experienced, whatever our role may be in society and as an elected official, local government leader, et cetera. And I think particularly, I don't know that I want to be an elected official or government leader at this moment in time, given the amount of stress and the negotiating that has to happen. But I'm so thankful for all the work that's being done there. I think really identifying and sharing in that collective trauma and healing is important as we think about going forward. So I think I would encourage folks to not distance themselves from what's happening, but really find ways to connect. We've been through a collective, I think, process at this point where we can share in some of the experiences. It doesn't look exactly the same for every one of us, but there's a shared collective, I think, grief and loss process in different ways for different people. And I think as we think about getting out of this and hitting the reset button, it's going to mean coming together collectively to also try to heal and kind of repair and move forward in some ways. Here's what we know about the psychological impact. So there was research done, and even before, what we know is that prior to the pandemic, someone was dealing with any kind of mental health concern, dealing with ebbs and flows in their emotions, et cetera, those were exacerbated over the pandemic. They were even more salient. They were even more relevant in their lives. And then for people who maybe weren't negotiating any kind of mental health concern or, just dealing with daily sort of struggles, they too also found themselves in that sort of space at some point in time to a certain degree over this pandemic. So again, going back to this collective process that I think we can all sort of connect with each other on in some ways. And then, from a psychological perspective, I read this great New York Times article a couple of months or so ago on languishing. If you haven't read that, I would encourage folks to take a look at that. There's this, from a psychological perspective, we have these really dichotomous perspectives. It's like either you're not doing well at all, you're depressed, or you're like thriving. You're doing well, you're sort of, you've got the energy you need, et cetera. And then there's this whole gray area and continuum in between where I think many people found themselves, and that was languishing in many ways. And so languishing is this sort of sense of stagnation. It's not that you don't have the energy to kind of do what you got to do and move through, but you're kind of muddling through your days. It's like some days feel heavier, a little foggy, and they were saying that this might be the dominant emotion of 2021. And as I read that, I identified with that on some level at some point in time. And so I think most of us can identify with some of the struggles and challenges. And I think some people, most people just didn't stop. But also people weren't feeling like they were thriving and had boundless energy, but they were sort of in this somewhere in the middle, just kind of doing what they had to do to get through and get by. And so I want to normalize that for folks. I think it's important that we normalize what we've experienced. What the reopening process, I think, is even tapping into some of these emotions even more so, because we continue. I think part of the challenge is when we have mixed information or information that maybe we get contradictory information. I think there's still a lot of lack of clarity around, like, so what exactly am I supposed to do? What exactly is this supposed to look like? What is my role? What are the social norms? What is all this going to look like? What's the work going to look like going back, and opening up again? And that, I think, that uncertainty, that unsettledness in some ways, it does not help relieve any of those emotions. In fact, it might even exacerbate them to a certain degree. And so I always tell folks, focus on what you have control over. Think about how many times that we just miss a meal, or, we forget to, take a break. And those things may seem like they're really small things, but in the grand scheme of things, they actually absolutely matter. We know that there was a study done through a human resource organization, and roughly around 60, this is a couple years ago, roughly around 60% of all workers ended up using most of their vacation days. That was around 40-something% that did not. And so as we go back, there's been a lot of psychological research that says we need to help people stop and take a break and breathe a minute and really sort of be in those moments, because we know that from industrial organizational psychology for decades now, that when people have a little bit more flexibility in their workplaces, a little bit more control, their productivity levels actually go up and increase at the end of the day. And so the question is no longer, can we work remotely? It's like, how can we make it work? Because we know it works. And so I think a lot of hybrid work will be important going forward.
I love that. You started to talk about some tips for how to continue to relieve the stress, right? Because we absolutely are going to continue to experience this. There's been the ebb and flow of open, close, beginning to reopen, maybe even planning to reopen, and then the Delta variant comes and changes a little bit more of our expectations. We're constantly being, shifting back and forth. You started to talk about tips for kind of relieving that stress. And I wonder if you have any more for us. You mentioned, thinking about what you do have control over. Number one, remembering to take your breaks, remembering to honor your own, personal needs, but then also your employees' needs, right? And acknowledging and supporting their efforts and needs to take time off and encouraging that. Are there any other things that you think might be helpful for our leaders, either personally or as leaders of their organizations, to relieve that stress as we continue to go back and forth?
Yeah, I mean, I think we have to prioritize. And I think we have to even just think about removing the word balance from our vocabulary to a certain degree, because, one of the most optimal states of sort of mental health thriving is like this a concept of flow and rhythm, finding your rhythm and flow, because life just ebbs and flows. And I mean, how many, I can't see all of you, but how many of you have ever really achieved balance? And when you really, really think about it. And so I think even just sort of thinking about what are realistic expectations. I always tell people, every time people say, I want to go back to normal, I want to go back to, I say, let's stop and think about what was happening before the pandemic that we might actually want to leave behind, that we don't want to take with us as we go forward, because it wasn't, we now know that it wasn't the most advantageous or helpful thing for us. So I think even just reprioritizing and sitting with what matters most, even as I think about in the workforce and employees going back, and I think about like a lot of psychological research, and there's been some research done with some companies that have shown that, maybe we can allow folks some flexibility to do that deep dive work that they can do on their own at home or alone, and then the collaborative work we come back together, so that where there's a hybrid of a situation that happens in the workforce. I think that's going to happen a lot more going forward. And I think that's actually probably a really positive, good thing. So I think prioritizing is really important. And I think also, this idea of being a parent, many of you are probably parents and you have kids. And so I think we have to also make sure that we're, as parents, that we're prioritizing our own self-care. This analogy gets used a lot, but I think it's important. I think it makes sense. But, it's like being in an airplane, you got to put the oxygen mask on yourself first before you can put it on others, particularly your kids, your loved ones, your employees. So as a leader, where's your oxygen mask? How are you breathing? How are you taking care of yourself in the midst of all this? And I think those kinds of, it could be simple things, Erica, like just eating 3 meals a day, or eating sufficiently and getting nourishment. Movement has been linked to psychological well-being for decades, and doing some kind of movement, even if it's for 10 minutes, 5 minutes, get up, walk, take a break, be intentional about those kinds of things that we just oftentimes, I mean, even as you started the webinar day, saying, we have an hour so we can get back to our busy day. And that's exactly right. Like, we will get to our busy day, and many of you will forget to do some of the most simple things to take care of yourself, like take a break, have a meal, have a snack, get up and walk. Those are things, or we can't underestimate the influence that those things have. Get enough sleep, all those things, maintaining social connections and relationships. So the opening process, I think, is bringing a bag of reactions as well. So a lot of people, like, finally I get to reconnect. Yeah. And then there's also this, like, what is that going to actually look like? So I think social connection is also very healing. And self-care can take many forms, actually. Could be drinking water, enough water a day. Honestly, it could be, just doing and self-compassion.
Yeah.
I want to really emphasize self-compassion for ourselves. That sometimes just enough is good enough for that day or that week, and that's
Giving
okay.
ourselves grace, right? To be as good as we are that day, right? And acknowledge that there
That's
might
right.
be some room for improvement. We try again tomorrow. I want to close out with this section by asking you something that related to something you mentioned at the very beginning of our discussion, which was you didn't want to be a local government leader right now. It's an incredibly difficult job, and at times, especially in the last year and a half, a thankless job. How do you recommend that some of our registrants kind of manage that pressure? Because I've heard that a lot from people that are just feeling like it is important work, but it is not gratifying in the sense that people may not understand sort of the pressure that comes with it, the responsibility that comes with it, and the fact you can't make everyone happy. That can really weigh on people. Thoughts about that?
Yeah, I would just say I mean, other than some of the stuff that I've already mentioned, I think really just um, reconnecting with why we do the work, reconnecting why you even do what you're doing, and the purpose and value of that. Because I think it's so easy to lose sight of why we do the things that we do and why they matter to us and why they're important for ourselves, for our families, for our communities. And so I would take a second to even just recenter oneself and kind of reground oneself in meaning and purpose. I think finding meaning, these situations is where resilience is built. Resilience is something that we can develop through difficulties, through challenges. And that, in fact, that's where we learn the most about who we are and how we can be successful. So I would even say, sit down, take a minute to think about, what have you been most challenged with, and how have you moved through that? Recenter, reground yourself as to why you even wanted to do this work to begin with and why it matters to you. Find the meaning again and the purpose of the work, because at the end of the day, we cannot please the masses. It's not going to ever happen. There's always going to be decisions that you are going to make that someone's not going to be okay with, and that others will be, and vice versa. I mean, that's just the part of the work. It's part and parcel of the work. And so I think, really, and then also I think try to be open to re-envisioning what the workplace and going back can look like. And I think that really has been one of the takeaways for many folks in the workforce, is really being open to re-envisioning and reimagining and being creative in terms of what this can look like moving forward. Because I can tell you that psychological science research tells us that it will make a huge difference in employee, colleague satisfaction, relationship, and productivity at the end of the day.
Wonderful. Thank you so much. And I do want to encourage everyone that's watching to take those tips for yourself and then also apply them to your workspaces for your staff. Thinking about especially the centering, kind of the reason why we do this work, the value of it, the importance of it. Every day finding that meaning is really helpful to keep that motivation high in spaces when you might get challenged by constituents that we love, residents that we love, but that people are also struggling. And so we might be seeing and feeling that firsthand. All right, thank you
Erica,
so much. Oh, go ahead.
just really, and then also I feel like as a leader, don't feel like you have to make all the decisions by yourself and alone. Get input from others, and so that way you're not doing it alone. That's all I'll say. Thank you. Thanks, Erica.
I love it. Thank you, Dr. Gallardo. We'll hear from Dr. Gallardo again at the end of the Q&A, but I would love to turn it now to our resident legal expert, Michael Youril, with Liebert, Cassidy, Whitmore, and we're going to talk about some of the legal ramifications and expectations and considerations as you develop your reopening policies for your local agency. And we're so excited to have you here, Michael. And we've got a number of questions for you, and we'll hear more at the end. Talk to us a little bit, Michael, about how local government leaders should be thinking about their reopening policies. And since we just talked to Dr. Gallardo, maybe frame it in the context of mental health. How should people be thinking about reopening plans in that context and thinking about how their employees might be feeling about this reopening, this expectation?
Yeah, thank you. So I think Dr. Gallardo was a good kind of segue into this, because, I mean, kind of some of the reentry is really not, it's kind of quasi-legal. Some of it was really addressing concerns that may not actually fit into like the disability box. I mean, employers are required to provide a healthy and safe working environment. And so with the pandemic, that's been implementing different protocols that increase safety and reduce the spread of COVID-19 in the workplace. And so if we look around today, your workplace doesn't look like it probably looked in January of 2020. A lot of us probably have the plexiglass up, even though for vaccinated individuals, the social distancing rules have been relaxed. That bubble is still a real thing for a lot of people. And, we're still seeing that people are keeping their distance. And some of that's a comfort thing. So when we had people being called back to work and we were returning people to the workplace, some of that was kind of, dealing with the psychological effects. We may not have they may not be raising a disability, but they're worried about it. So part of that was saying, here's the things we've done. And some of that's following the actual legal requirements. So we have regulations out there that there's things that we have to do as employers to provide a healthy and safe working place. But some of that stuff is just based on the individual working space. And so again, putting up those things like plexiglass, a lot of us put in markers so that people don't stand too close and those kind of things. And really conveying to people the things that the employer was doing to create this healthy and safe working environment to help people kind of return. And then, dealing with additional safety protocols to kind of help ease people back in. So, as I mentioned, there is that obligation to provide the healthy and safe workplace. We obviously have to follow those. All the employers have seen the Cal OSHA regulations. And I know, especially the HR directors and HR people, really everybody out there listening knows how really fluidity is really important in the return to work because, again, every situation, every working environment is different. But on top of that, we're an evolving situation, right? We've got, we had the shutdowns, we've had variants, sort of things are still very much changing. It's probably, within the next couple of days, we'll have different rules. And I think that flexibility is a big part of reopening. And, saying the HR directors and people out there, you had to, especially when things were changing, you'd have a new health order coming out every day, and then that would be an executive order that might have changed that health order. And then regulations came out, but then CDC, the California Department of Public Health had changed their guidance. And so we needed an executive order to line those up. And so a lot of it is really kind of was being flexible and fluid in the return to work process.
So thank you for that. Are you finding then that organizations, so let's say you find an employee that says, I cannot come back to work because of, I feel personally unsafe, or for mental health reasons, I feel like this is going to continue to challenge me. Is an organization required to make an accommodation with the current guidance?
Right. So the first kind of part I was talking about is more like the kind of informal, making people comfortable where they may not dealing with a disability, but mental health stands on the same footing as physical disabilities. And so really the process is kind of the same that you see with, physical work restrictions. We're just dealing with, mental health or psychological restrictions. And so the process is really kind of the same. And so typically what will happen is we'll have some kind of legal trigger that suggests that maybe there's a disability. And usually that's going to come from the employee. So they might say, I can't return to work because, of fear, whatever it is, or, I have a psychological condition that doesn't allow me to return. And so that in that instance, we would be engaging in the interactive process with the employee. So typically what's going to happen is there's that trigger. And so usually it'll be the employee telling us, or maybe more frequently, we actually get a note that says, something to the effect the employee has a disability. And at that point, we would engage in the interactive process, which we would try to look at what their work restrictions are, and we would determine whether we can provide a reasonable accommodation. And so we would look at what it is that they are requesting. Some of those accommodations earlier on were really easy. Maybe they wanted to be, they wanted to make sure that they were in an area that was separated from other individuals, and we could accommodate that because we were already social distancing. But we would kind of drill down and we determine whether or not we can provide an accommodation. Now, there is a little bit of kind of some tricky issues here. Like sometimes we might get a note that says employee must telecommute. And that might not necessarily be enough information, because really what we want to know is work restrictions. What are the employee's work restrictions? Telecommuting is really an accommodation. And so that's really like, sometimes what we get from doctors is a recommendation for accommodation. And sometimes we can't give the recommended accommodation, but we might be able to engage in the interactive process and identify something that still satisfies whatever their work restrictions are, and but may not be telecommuting. Or maybe it's, as Dr. Gallardo mentioned, maybe it's a hybrid schedule where certain tasks can be done at home, certain tasks are at work.
So there's a lot. Thank you for that, and I agree that there seems to be a lot of there could be a lot of people that have similar requests and accommodations, very different than what might be in the past, one-off, request from an employee. So you might get numerous employees coming in with similar requests. And so is it your recommendation that as agencies are developing their policies, that they consider that and that they build some of that into the flexibility that's needed for their policies so that they aren't going to have to provide individual accommodations for every person? Or what are your thoughts on that? I mean, it seems like there might be ways to develop these policies so that it's accommodating for, this swath of people that might be coming with similar concerns.
Yeah, so there's a couple different, I guess, issues at play. So when it comes to the accommodations, one of the issues we have is you can't have maybe a hardline policy. So you couldn't necessarily have a policy that says no one can telecommute, because really what we'd have to do is if somebody comes in and wants to telecommute, we have to engage in the interactive process to determine, whether that's something we can do or if it would cause an undue hardship. And that is going to depend on the position too. Like if somebody is in a customer service position where they actually have to interface with the public, that might not work on a telecommute situation. But there's other things like maybe a research analyst has little to no reason to really be in the office. And so it is important to maintain that flexibility and to really look at it on a case-by-case basis. You can't necessarily have like a blanket policy. And then, just as a reality of telecommuting, I mean, I would say, a couple of years ago, most public agencies, I think, were kind of holding the line. There was very little telecommuting going on. Even where that was requested as an accommodation, it was, kind of pushed back against, and we tried to identify other accommodations. And at that time, for most agencies, I'd say telecommuting have been very rare. That employers either had even hybrid schedules or especially people that were telecommuting full time. But when this was forced onto public agencies and everyone had to adapt really quickly, we now know that we can actually telecommute probably a large amount of our staff. And so now when we're doing the undue hardship analysis, it's much harder to say that that's not something that the agency could do, because we did do it, or most of us did it, for a very long period of time, at least with some positions. And so I think that, you do have to maintain that you can't have a blanket policy. You're going to have to maintain, again, flexibility and see where the interactive process goes. And it's, again, going to depend on positions and individual job duties and whether collaboration is required. So all those are going to be relevant considerations.
I love that. Thank you so much. One more question before you jump to Rob. There are lots of different types of needs, and some of these needs have been elevated, and employees with different situations at home, I think, have been highlighted, right? So you've got parents whose children may or may not be in school, they may or may not have different requirements for whether they can even come to work, and you've had to make accommodations for those. Can you talk to me about the legal requirements or ramifications of having different options for people in different personal situations, right? So allowing a parent to have a different type of schedule than someone who doesn't have children, for example. What are some of the thoughts around that, and what are some of the considerations around that, given that you might have people that are, frontline workers that do need to be there, but then there's also that need for an accommodation for this very extenuating and special circumstance?
Yeah, so I guess this is one of those questions that's kind of like it may be more about what workforce you're trying to retain than necessarily a legal question. So now that we've seen, we're going to see this at the local agency level, is what you're going to see is more, especially as the job market tightens in certain sectors, you're actually going to see employees saying, this is the type of arrangement I want. I want this type of flexibility. And to compete in the job market, that's something that agencies are going to have to look at. So for example, childcare, and I don't mean caring for like an ill child. I mean, being a caregiver, on a general level, taking kids to school, making sure that they have lunches and all those kind of things that are extremely important and time consuming. A lot of those aren't, like, for example, protected, where you could say, like if you have, surgery you need to get, you can take FMLA or CFR leave, and you can take a leave of absence from work, and that would be a protected leave. Certain criteria are met. There isn't really that level for childcare. So there might not be a protected reason, but there is maybe some flexibility that needs to take place to be, kind of a competitive employer, because maybe going forward, especially as more employers are allowing hybrid schedules or telework schedules to be competitive in the labor market, essentially, you're probably going to see applicants and people start asking for those kind of things, for those types of flexible schedules. Kind of outside the scope of ours, we could talk about this forever. You do have to be careful with some of these flexible schedules, because you have wage and hour issues that can come up. The for time worked and tracking time out accurately and everything. But I mean, so if you have a legal trigger, then I think you have to go down the path of, it's like, for example, if it was a sick child, we would be looking at, is this FMLA for to care for a child? Is it kin care that's protected under the labor code where they can use half their sick leave? So really, I think you need to first, when you're getting these requests, you're looking at, okay, do I need to look at this as a legal issue where I'm actually applying some kind of statute or regulation that provides them some type of legal right, like if we're talking about FMLA or disability leave, or is this a workplace flexibility issue? And if it's workplace flexibility issue, we still want to be make sure we're consistent, because the idea is when you mention different jobs and things like that, if we treat similarly situated employees differently, then we do risk discrimination claims, right? I mean, somebody could say, well, the reason you let employee A do this, I asked for the exact same schedule or accommodation or whatever it was, and you said no, and we're exactly the same. And in those situations, that can be problematic. But again, sometimes there are reasons to differentiate. Like, again, my example of somebody who is in a really service-oriented job, that may not work on a full remote schedule. Whereas if, it's more of a kind of an independent type job, it may work on a telecommute or a hybrid schedule. And a lot of agencies are adopting kind of formalized policies for requesting telecommuting on either a limited or ongoing, permanent basis. So, that's something we're seeing is really policies that address this flexibility.
Wonderful. Thank you, Michael. And we're going to come back to you. We have a couple questions in the chat that I definitely want to get to. And I want to, though, before we do that, go to Rob to talk about some of the operationalization of this and how one agency has actually considered some of these issues and built a policy that is certainly dynamic and evolving. But you've been responsible, Rob, for helping Smud get its telework and return to work plan up and off the ground. Can you walk us through the basics of your operational plan, how it was developed, what stage you're in, kind of what are some of the basics, and then talk to us about how you guys are experiencing this rollout?
Sure. So good morning, everyone. And I'm really happy to be here, and thank you, Erica, for the invite. First thing, just a word of caution, I suppose. As the Director for Facilities and Security for Smud, it was felt that I would be best suited to manage this reentry process moving forward because there's a lot of logistics that go with it. But I'd be remiss if I didn't share that I'm not doing this alone. I have a very robust team. We've been meeting bi-weekly now since basically last June, so June of 2020. So my word of advice or words of counsel would be, if you're looking at reentry and you're pondering what to do, don't go it alone. Ping other professionals, build a team within, and have that team that's very diverse from the perspective of different walks of life within the organization. We have people services, the director that joins me with these meetings. We have our environmental health and safety team. And there's a variety of other folks. Our communications directors involved actively. So it's about 6 specific departments that meet every 2 weeks. I've just been anointed, if you will, head of this little working group to get us over the hump. So at any rate, can you repeat your question? I just wanted to get that out there as kind of an opening statement.
Absolutely, and that's an important thing. No one does it alone. Bring the team in. I think that's so critical to these discussions because the perspective of the larger group is going to help. The diversity of those thoughts and opinions are going to help build a stronger plan. Can you give us the components of your plan? What are some of the major elements of SMUD's kind of either return to work or reopening policy?
So, you also have to understand utilities are very conservative entities by nature. SMUD is very forward-thinking, and which is a wonderful thing. But we've had philosophies now for decades that, to function as an organization, you've got to come to the office. Well, there's a core of our employees, probably north of 700 out of the 2,000 plus, that have been coming to work every single day. I've got 140 employees that report to me. 75% of them have been coming every day since April 1st of last year when we officially shut the building down. But we've got line workers and troubleshooters, my security team, my facilities team. They've been coming to work every day. But we built our reentry team recognizing candidly that Rome wasn't built in a day, and we have to kind of shift some of the philosophy of a utility. And we've actually made great headway with that. And kudos to our executive team that has really been with us stride for stride on this, that they're truly recognizing that as we're talking reentry, because we've learned over the course of the last year plus that, working remotely is pretty good. It's perceived as a benefit for the 1,300 plus employees like me. I've been to the office 7 times, literally, since April 1st of 2020, and I'm a director. And I'm here to tell you I'm working tenfold more hours than I was coming to the office. So, but we've learned as an organization that you can actually function, get the work of the people done. Again, when you've got field workers, they've got to go to the office. I can't have a security operations officer on my team sitting on their couch doing emails. No, they have to be out patrolling like I pay them to do. But for the 1,300 of us that are in research and development or in accounting, a level of customer service, some of our account management, we've learned that you could actually function well from home. So you have to factor that in as you build your plan. But in our plan, we have essentially 3 key areas. It's facilities and logistics. How do you move these people back in? How do you accommodate them moving forward? We have the health and safety elements, and then we have the people services and / kind of communications. But I would also suggest to you all that we'd be kidding ourselves at Smud if at the end of the day it wasn't our health and safety team that really signals when it's safe to come back. It's not Rob Lechner, the facilities director, that says, okay, here's where we're going to reenter. It's going to be our health and safety folks that are tracking the numbers, X number per 100,000 cases testing positive in Sacramento County, so on and so forth. I will also share with you, we did make a decision, the execs supported our decision just recently, that we were going to return September 1st. And because of the spikes and the Delta variant and the other variants that are now popping up, we decided to postpone official reentry until January 3rd of 2022. And that date is subject. It won't be before then, but it could be after that. So the key elements for us are logistics, health and safety, and the people services / communication part. And if you have those 4 aligned or work closely together, you can pull this thing off. Now, I'm going to jump ahead slightly, maybe, Erica, to give us, I think, a key point in. We are in our team, from a logistics perspective, really working to determine how do you address the remote worker versus the employee coming back. So we made a decision with the executives 2 weeks ago. If you're 51% of the week at home or more working remotely, you have officially given up your workspace at Smud. I'm going to let that sink in for a minute. There's no cubicle with your name on it. Rob has no door, no office placard, nothing that says my name. I'm done. I don't go to the office. But I'm going to go 2 to 3 days a week, and I'll work at a hotel workstation. So we have spent an enormous amount of time, communicating that if you're 51% from home or remote, you've given up your workspace. If you're going to come back in 3+ days a week, you'll still have an assigned cubicle. We are attempting to accommodate a 6-foot separation, if you will, as best we can, but creating more hotel workstations. That's really is what's driving us right now. How do you create X number of hotel workstations? And we're implementing a new tool, a reservation tool that you can log in and you can reserve a hotel workstation for 4 to 8 hours, 4 to 8 hours. You can't squat at a hotel workstation for a week on end. You can come in for designated days. So we're doing things like that, fine-tuning that process.
Wow. Okay, that is so interesting, and I'm curious to know. We're going to come back to you because I want to learn more about the logistics of this. But we are at our Q&A timeline, so I want to invite all of our panelists up. We're going to start peppering you all with questions, with more details about each of your elements. And certainly want to acknowledge that there are we've asked a couple of the questions already in the chat, but I want to make sure that we get to a couple more before we close out. I would love to, Rob, I know that you might have something that you can share. If there is anything that you can share about Smud's reopening plan, high level, we would love to include that in our follow-up. If you're comfortable with sharing any of that within, that's not proprietary, we would appreciate it. Keeping
Sure.
this moving though, I would also love to know, let's start with the legal thing. So let's go back to Michael and talk quickly about FLSA. So we've got somebody in here who's asking that if telecommuting is the new normal moving forward, how do we balance that against FLSA rules and requirements? So this particular agency has a temporary emergency telecommuting policy now, but they never expected it to extend this long. So how do they manage those rules without kind of, not accommodating what it was intended for?
Yeah, so one of the if you're working on maybe doing it more long term, you probably want to update your policy. And one of the things you want to do is to convey that all work time needs to be recorded. And so you have to make sure that they're actually recording the work time they're working, because the continuous workday rule was suspended, which meant that you could actually break up your workday without having to, necessarily work it as a block. And so what would be problematic, for example, is we would see employees were kind of putting down 8 hours on their timesheet like they used to do when they went into the office. So they'd say, I work 8 to 4:30 with a lunch, a 30-minute lunch. But in reality, they decided to do you could see from the email traffic that they're doing their work between 8 and 10 at night, because maybe with their family care and what they were doing, that's when it worked out, or that's when they actually tended to be more productive. Even though they used to have to work in an office day setting, they're actually night owls, and that's when they really do their creative thinking, or when they really tackle their inbox or whatever it is. And so, in that instance, you have this where they're documenting hours that aren't matching with time that we can actually see, like we can see the emails. And so that's problematic. And so what a lot of agencies do is if they're kind of require them to work in a certain block, they may disable their emails or things like that during, outside of working hours. But, that may not be as productive for some people. But absent that, you should be making sure that you're actually, your non-exempt employees are actually recording the time they're working, not just putting in, 8 hours or whatever it is. And then your policy should state that, employees are prohibited from doing work off the clock. Any time needs to be recorded, and making sure that you have very clear policies that there's really no off-the-clock work allowed. And, that's important too, not just for FLSA liability, but for, other mental health and burnout issues, because one of the things is some people love this work from home, and this is kind of more Dr. Gallardo's domain, but some people loved this work from home and were really productive. And for other people, it's not something they liked, and it actually caused creep in their life where they felt like they were always working all the time, because since their home became their new workspace, they would be responding to emails at 10 o'clock at night or whatever it is, when they used to just do their stuff in the office. They would have this separation between work and life. And there's been that kind of bleed over. And, so there's a legal thing that needs to be managed there, but it's also a very important mental health and burnout issue that might need to be managed.
Yeah, that's a great point. Thank you so much for that. I have a quick question for Rob. Somebody wants to know what program Smud is using for the hotel reservation system. Do you happen to know that off the top of your head?
Yeah, it's Archibus tool, and I can get the individual more information on that. But we're simply using the platform that we use for our conference room reservations, because we've got dozens and dozens of those. We're simply taking this Archibus tool, expanding it out. It's costing me about $40 grand to do it, but it's going to be money well spent, because this is the new normal for Smud. It's going to be hotel workstations or assigned cubicles, very little in between. The other cool part is that when you reserve a hotel workstation and then leave it, it automatically pings our sanitization team, our custodial team. They then go out and clean, and there's always a 15-minute gap allowed in between. And then we'll leave a little marker out there that says the station's been cleaned. So we're being pretty, retentive about this.
Wow, that's amazing. Thank you so much for that, Rob. A question for Dr. Gallardo. So lots of questions in the chat about beyond just this concern around the reopening, but it seems to be even broader than that. Dramatic fear, fear of dying, fear of exposure, fear of just actual fear related to that return. Can you talk about how someone who's experiencing this or is in the leadership capacity for someone who is experiencing this, how they can help them navigate that? What are some of the tools for people to address the literal debilitating fear of coming back into a space that they don't believe is safe and that could cause, their death?
Yeah. I think that's a legitimate concern, and I think a lot of folks obviously are experiencing that. I think one thing I want to encourage folks, I don't know what all the policies are in all these different agencies and entities. But I think certainly if there are mental health services available to employees and to staff, that they consider talking to someone who can really provide them with the support that they need, a professional to support them. I think, I want to also distinguish, so like the difference between crisis and chronic stress. And so in a crisis, most of us have this fight or flight response where we just do, we respond, we get it done, and then maybe there's some cascading effects after that. Well, we have, and we can respond and do most of the time do what we got to do. In a chronic stressful situation, which is this pandemic is really, I think, could be categorized as, the implications on mental and physical well-being, I think, can be debilitating. I think you're talking about some of those debilitating fears and concerns. And so, again, I go back to focusing on what people have control over, revisiting workplace practices, employee involvement, health and safety. I think all the things Michael has mentioned, Rob, that they're implementing with Smud. And I think all those things have to come collectively together, really, to provide the support for some of these employees. But I can't emphasize enough, though, that the one thing, so I always think about my glass is always half full and as opposed to half empty. And so during this whole pandemic, the one thing that I think has really taken front and center stage at many times and continues to is the importance of taking care of one's mental health. I mean, I think before we really prioritized and gave more legitimacy to the physical than the mental and the psychological well-being. I think that's changed. So I really want to encourage folks, we need to destigmatize this idea of going and talking to someone, a mental health professional, because again, going back to what I said at the beginning, we've had a collective grief and loss process in different ways for different reasons. It'll look differently for all of us, but there's been a collective experience. And so, which means that the things that I have been talking about to my colleagues for decades, which is that we all have moments. We all need support. We all should be talking to someone at some point in time just to sort through things. I think at this point, I'm hoping that people will see that as a legitimate, viable option for them, and we can destigmatize this idea that only people who are really off on the extreme side of the mental health wellness component and continuum are the ones that go see and talk to someone. I mean, this is for all of us and for everyone. The majority of the people that most of us end up seeing in our work are folks like us. Everyday folks negotiating everyday issues, trying to figure out how to move through anxiety, fears. The anxiety is off the charts at this moment in time. And so I think seeking some psychological support, again, as a leader, the factors that make up a psychological healthy workplace are assessing workplace practices, employee involvement, health and safety, employee growth and development, work-life rhythm and flow, employee recognition, communication, all those things. And there's an opportunity, I think, to really do that and support the staff in trying to move through those issues. Validate those things. I think validate people's fears and anxieties, and even get in touch with maybe some of our own experiences with regards to that. So there's a connection there.
I love that idea, because I do think you're right that we have a tendency to go into the operationalizing of it and thinking about the very physical space. How do we get people back? But if we don't think about the emotional well-being as well and really connect those dots, it won't be a full baked plan, right? It won't have all of this of the components that it needs, and it probably won't address what a lot of people are feeling in some way and along some continuum. So I do think that's important. I appreciate you all saying that. So we have a number of other questions, and they're diving in. And I appreciate you all for dropping these in. I'm going to ask about the legal ramifications of these. Some of the questions we're getting are around the operational and logistical pieces and some recommendations for how to get people and get office operations back up and running. I don't think we can cover all of that today, but I do want to talk a little bit, and maybe I'll ask Michael for this one. Public meetings. You've got expiring waivers for the Brown Act, public meeting requirements. We've got staff that are really concerned about how to do this safely. There's two issues here. One, you've got to go back to that. Do you have any content or context that you can offer from a legal perspective around Brown Act requirements, public meeting laws, and then staff that don't want to support that potentially? Oh, you're on mute, Michael.
Sorry,
You're on
rookie
the
mistake. So some of it's going to be looking at, I mean, one, we're going to see if some of the stuff's going to get extended. But what we're probably kind of seeing, what we've seen too is, and one of the things we're going to talk about is innovation, but this was something that was a big change. And I think some of these changes are going to stay. So when we started doing, I think you're going to see more people are going to continue the streaming who weren't doing that before, who are now doing live streaming and some live interaction. I think we're probably going to maybe see some more of that going forward. As far as the as return, the board meetings, we're going to see some of that being a part of the return to work protocols and safety protocols that are in place, and it's part of making sure that we're providing a healthy workplace and we're dealing with concerns. So we're looking at legal and kind of sometimes maybe it's not really a disability and that it needs they haven't provided documentation, but we're addressing it as kind of a concern of theirs. And so you'll see at public meetings, we'll see more people wearing masks, even though they may not be required to, or some agencies have required mask wearing in those settings, even if the person maybe is vaccinated, wouldn't otherwise be required to do so. We're going to see and continue to see limited capacity seating inside the actual meetings, and probably more remote, where it's still being broadcast to other rooms so that we can spread it out. Public comment being given through electronic means, as well as having systems to kind of funnel people in and out to do public comment and the like. So that's kind of what we're seeing is, even as we've seen a lot of boards and governing bodies go back to in-person meetings, but we're still seeing the dais is being spread out still. People are wearing masks, staff is spread out. We're not, we're still not at a place where we're packing people into these rooms. And so even if we can't do the remote appearances anymore, we'll still have, I think, that flexibility for a while where we're kind of keeping some of those safety rules in place.
And if an agency is doing all of those things, an employee still says, I don't feel safe, is that something for legally a reasonable accommodation?
Well, so that's when I think it needs to go into the legal path, is where an employee says, I can't do this. So at that point, we're on notice that maybe this is a disability issue. And so we might say, okay, if you want to turn in some medical documentation about what your limitations are, your work restrictions are, then we can try to address that. And so we would push that into the interactive process box and see if, is there something either we can come up with that can alleviate your concerns, and if we have work restrictions, then we'll address those and deal with them and talk it through as part of the interactive process. Because even if they say, if an employee says to you, I can't go to this meeting, I'm too fearful. And sometimes, even if there's not medical documentation, again, we can sit down with them and say, okay, what kind of things are you looking for? And sometimes it's something we can provide. So at some point early on, some employees have said, well, I would feel better if I had an N95 mask, which were harder to procure at certain parts of the pandemic. And so, sometimes providing things like those, or if we can you assure me that I can have this space and it won't be used or it'll be wiped down? And so, sure, we can do that. And so part of it, again, may not be like necessarily the interactive process in the sense that we have a doctor's note, but maybe we're dealing with it as a concern in the workplace for safety.
Great, thank you so much. Okay, quick logistical question for Smud. Rob, do you know if Smud offers employees who choose to work from home an allowance to help outfit their home offices for ergonomics or otherwise?
Yes, we did. It's a $500 allowance one time, and we allow you to go out and buy the appropriate ergonomic furniture and so on and so forth. It's a one-time $500.
Wonderful, thank you. This is maybe a question for Dr. Gallardo, and I know we're running late on time. I don't know, I want to respect our panelists' time, but I do want to ask this other question because I think it's interesting. Here's a question that came in about the racial or cultural considerations that agencies should consider in the return planning. And I'm thinking about Dr. Gallardo because I know you work really closely with the Latinx community. Can you think of any considerations that should be thought through as agencies are planning for this work?
Yeah, I think that's huge. That's a whole nother, hour and 2 and 3 together. But I think what we know is that many BIPOC women and many BIPOC and Black Indigenous people of color were deeply affected, not only by the realities of the pandemic and what was happening with regards to work, childcare, family life, et cetera, but also on top of that, just the discussion and the discourse around racial justice and systemic racism and the historical legacies that we continue to see happening today in the United States. And so I think the one thing that I've seen a lot of folks do, again, my glass is half full, I think I've seen a lot of organizations and entities really try to make a concerted, intentional effort to recognize, to affirm, and to acknowledge the impact that racial unrest and systemic racism has had in the United States, and how that affects, obviously, families, individuals, communities of color, et cetera. And so I guess the other thing that I would encourage folks to do is to think about your equity, diversity, and inclusion efforts as you look at your workplace practices, employee health and safety and well-being. That this is the buzz terms at this point: diversity, equity, inclusion, equity, diversity, inclusion. And so I think really, what does that mean? And so not just necessarily doing that now while we're in the middle of things, but making an effort that's long term, that's sustained, just like we are making efforts to re-envision our workplace in general. How can we re-envision our equity, diversity, and inclusion efforts with intentionality, so that the impact stays long after the dust settles? Because employees of color have been hit in multiple ways, multiple traumas, both from the historical traumas that many of us experience, to the triggering of what's happening now, to many of us having been affected by. I have relatively a high level of privilege at this point in my life, and I have been directly impacted by what's happening in the world right now, both through the Black Lives Matter movement and just seeing the many other I think conversations and dialogues happen. And I've had people insinuate, say things. So these are legitimate concerns that I think we really need to really honor and pay respect to, and really do something about in some meaningful way. Not just a performative allyship, but a meaningful connection and commitment. Don't just do something when people are watching and because it's the popular thing to do, but do it because we are all connected. We are all human beings. What happens to Rob and Michael affects me, and hopefully what happens to me affects them in some way or another. And I think that is where our shared collective humanity should really come into play. I don't want anything to happen to any of you, and hopefully people don't want something to happen to me either, right? And so I think we have a commitment and a connection to each other, and I think that we need to recenter and revisit those processes as we move forward.
I appreciate that. And one of the things that I think Rob said early on in developing their plan, Smud does have a matrix team and they've been incorporating a lot of departments. I would imagine too, and Rob, validate this for me, but I'm hopeful that you had employee input as well, and certainly maybe even employee resource groups or cultural organization representatives to speak to some of those impacts and help inform that plan. I don't know that that's the case, but I would think that that's an opportunity for local agencies certainly to bring those divergent voices together and make sure that those perspectives are considered.
Well, the short answer to your question or statement is yes. We have had countless meetings, countless touch points, if you will. And it's been very, very positive, very, very productive. Because you can't work in a vacuum. But keep in mind, from a purely logistical perspective, asking employees a simple question: are you okay working at home? Do you like it? And can you justify that it's okay for this to occur? Remember, as I said earlier, this is a major culture shift for utility that provides electricity. This is all brand new stuff for a lot of people. It's not just a Smud, naturally, but and so just asking the question and affording that opportunity. And we have about 875 employees have signed a remote work agreement. It'll be darn close to that number when we're all said and done that will be working remotely permanently. Mm-hmm. And that's pretty staggering when you stop and you think about it. And by the way, just real quick note, we're doing our reentry in phases. Phase one will be about 150 employees that have stated they want to come back. That will be in January. And then it'll be a 30-day rollout, because you don't invite 150 people back on day one because they all have IT issues. They all have, my chair's missing. Why is my desk not the right height? And hey, what happened to the water cooler? We were not going to accommodate 150 people on day one. So it'll be spread out over a month. Roughly 10 to 15 per day are going to be allowed back in. Hit the pause button. Phase 2 will be about 100 employees. So all total, we're going to re-enter about 500 employees over a span of 4 months.
Wonderful. Thank you for that. And Rob, we will definitely take you up on getting the kind of the step-by-step of what your reentry and reopening process looks like and the phased approach. Love that. I know that we are.
It kind of looks, by the way, like it's how you make sausage or legislation. So just be careful when you read it. You've been warned up front.
Messy is okay. We are all practitioners here. There is no judgment. We're just grateful for your insights. I want to close out because I do want to respect our panelists' time. Michael, this is a big one, so I'm gonna put you on the spot a little bit. We got the question. We knew we were gonna get it. Should local agencies be mandating vaccines for their employees?
I could have put a confident bet that you were going to ask me that question. Yeah, I don't know that there is a firm answer, yes or no. I think it kind of is going to depend on the workplace, but we are now seeing, and I think it was predictable, a huge move towards that mandatory vaccine. And I think you kind of saw the state trying to kind of, exert where it could, that it was really going to try to push the either vaccine or testing protocol, to kind of encourage it to be used. And then once we got approval, whatever it was last week, then we really, it was like the tide turned. I probably only had a couple of clients that were looking at that. And now I would say that, we're probably maybe even looking towards going that to be maybe part of the, becoming the majority. And so I think we are seeing a lot of agencies going towards that. Agencies are rolling out those policies. I think the big thing you need to keep in mind is when you're doing those, you have to remember that there are not only ADA FEHA issues where you have accommodations you need to make, but we're also looking at religious accommodations. And so you'll have to provide, when you're putting in place your mandatory policies, you're going to have to have those kind of exemptions and a way to document those exemptions. So most agencies are creating an opt-out form that explains, here's the, so if it's a disability issue, you can ask for medical documentation. If it's religious, then, they would attest to it. And we usually probably would ask, you ask, how does it conflict with your religion? And basically a very short statement. You really aren't able to ask that much information about it because it involves a sincerely held religious belief, which is kind of hard to, prove or probe. But, whether it's recommended, I think you'd have to look at, kind of based on your work realities of your workplace. But I think a lot of agencies are moving into that direction. We're going to see that trend continue and probably end up in the majority.
So if that is decided, they certainly wouldn't be alone. We're seeing that groundswell, certainly. And the alternative to that is we're seeing some private companies certainly increasing the cost of insurance, adding a premium for those that choose not to, those kinds of things, which are an interesting, certainly for local agencies, it's a very different approach. And I don't know that that's something that could be done, but certainly something that we're seeing in the private sector as we come up against these really unique challenges for our communities. There are more questions in the chat. Some of them fit really nicely with this bucket. Most of them we caught to. There are a couple others that I think are more for a different leading local session. We definitely want to acknowledge that those questions are in here. We'll shoot those questions that we didn't get asked live to our panelists. And if they do have answers, we'll certainly send them to the larger group when we do our follow-up email, along with all of the materials for this. And wonderfully, Michael has a great PowerPoint that we're going to share with everyone that kind of outlines additional legal topics that we didn't cover today. We want to make sure you have that. Rob's going to share what he can of the reopening plan that Smud has identified and outlined and how they're evolving through this process as we all are being dynamic, being flexible, and certainly acknowledging that things are changing every day. So Rob and Michael, thank you for sharing those resources. And Dr. Gallardo, your insights have been so helpful, and we just appreciate that we're normalizing the conversation around mental health. We're normalizing the fact that this isn't just a logistics and workspace issue that's physical, it's also very mental. We're all feeling some kind of trauma and have experienced that over the last year and a half and continue to. And the more that we all as leaders can own that and honor that and then bring our employees into this conversation, honestly, I think that will help everyone feel differently about this process and differently about their approach. And it might inform the plans that you all put together. As I mentioned, we could talk about this for another 2 hours. We won't do that. I do want to transition us into our closing and thank all of our panelists Here are a number of the leading local webinars that are coming up, but we're going to add a couple more. We have some flexibility with these topics, and we got some great questions in here today. Maybe we'll do a reopening part 2 that talks a little bit about cybersecurity, that talks about some of the other questions that we got that aren't perfect for today's discussion, but I think are really important. So keep an eye out for those in the coming weeks when we discuss additional leading locals. We've got other upcoming webinars. We're hosting dozens of them through ILG this year, and next week we're going to be hosting a webinar on our housing crisis, and the topic is climate resilient land use. We hope you will join us for that. We are also, if you go to the next slide, excited to relaunch our public engagement training series. It's called Tiers. It's focused on embedding authentic and effective and inclusive public engagement practices that really encourage that public confidence and trust. For those of you that asked a question about how to do public meetings in this no COVID environment, and maybe how to incorporate hybrid, virtual, and in person, this Tiers training is really a deep dive training on some of those topics. We've revamped it for a virtual environment. It's a virtual training. It's still over 2 days, but it's 3 to 4 hours each day. And it really does cover some of this content on how to operationalize this new world that we're in. Lots of post-COVID resources with an emphasis on virtual and hybrid engagement strategies. So this training's almost sold out. The deadline's actually today to register for yourself, for your team. I encourage you to forward that on and reach out to us if you're interested so we can save a spot for you. Next slide. We hope you'll stay connected with us as well. We know that there's a lot of information, lots of changing, lots of trainings and resources are available through ILG for cities, counties, and special districts. And these are just some of the ways that you can connect with us. Next slide. And as I mentioned, the recording on this webinar will be available soon. And when it is, we will email you all with those attachments, which include resources from a legal standpoint and also that sample operational plan from Smud. Want to thank you so much for those resources. And we want to make sure that you have what you need as local agency leaders to implement this on the ground. So this does conclude our webinar on reopening anxiety. Panelists, I want to thank you for your time today, your extra time today, and for providing so much valuable information to our attendees. It's so good to get your perspectives and your insights. And also a huge thanks to our registrants this morning. Thank you for taking the time to be with us today. It has just been an honor to have you join us. On behalf of the ILG team and the entire panel today, we hope that you have a fantastic rest of your day. Good evening and good morning and good afternoon.